Yeah, I am with the Sentencing Project, which is a national organization based here in D.C. We've been around for over 25 years. At the Sentencing Project, we are a research and advocacy organization. You can find us online at sentencingproject.org. We put out reports throughout the year tracking trends in incarceration, and we also do advocacy at the federal and at the state level. My focus is on state level advocacy, and that's what I'm going to focus my comments on this afternoon. I would say that the fact that we're in the district, there are obviously local drivers, local best practices that we should be concerned with in the district. Many of my comments will be focused on state policy. There is an emerging conversation and national infrastructure around supporting and reinforcing local drivers into local jail systems. So this is what I'm going to focus my comments on, like that overview of mass incarceration. We are going to talk about prison closures, since this campaign coalesced around the fact that the CTF contract is up for renewal or hopefully termination in March of 2017. So I'm going to highlight actual examples of that to let us know and develop a shared analysis around the fact that it is politically possible to move towards prison closure, particularly private prison closures, and there have been states that have experienced that over the last couple of years. Then solutions that we at the Sentencing Project promote as a part of our orientation and worldview, and then also want to highlight before I turn it over to the rest of my co-panelists, this moment that we're in post-Ferguson, post-Staten Island, in terms of the politics of Black Lives Matter, and how I hope that drives a different approach around public safety overall, and that public safety isn't just defined by arrest or admissions to prison. Next slide. So most people are familiar with this curve and the fact that during the first half of the 20th century, or more than the first half of the 20th century, thank you, that the incarceration rate in this country was stable. It rose, it increased a little bit, it fluctuated a little bit, but for the most part, it was stable and nowhere near the scale of incarceration is today. I think what's important to remember about this period is that people were held accountable for homicide offenses. They were held accountable for serious offenses like robbery and burglary and other offenses of violence. But during this period, there was also an opportunity for meaningful review and release for folks who were incarcerated for serious offenses. And that the underlying drivers that frame our criminal justice system in this country shifted dramatically a little over 40 years ago in the early 1970s. So go to the next slide. So again, I'm sure all of you are familiar with this curve, that over the last 40 years, the incarceration rate skyrocketed in this country. What led to this curve and this dramatic escalation in the number of people who were incarcerated was a mix of policy and practice, ranging from enforcement, high levels of enforcement in certain communities, to statutory changes in state criminal codes, policies that many of us are familiar with, mandatory minimum policies, truth in sentencing policies, abolition of parole, life without parole policies. Today, we lock up over 2.2 million people in state prisons and in federal prisons, but also at the local level in county jails. And again, the district is not a state, and it's more complicated than a county. So in terms of developing this local analysis that moves the coalition forward, will be focused not only on drivers into our local jail system, but also in terms of criminal penalties that send people into prisons, and district prisoners are incarcerated in the Federal Bureau of Prisons. So, some of the big narratives around mass incarceration are changes in policy that many of us are familiar with. In the mid-'80s, high levels of drug use and increased violence in the drug war led to mandatory minimum policies like the notorious crack powder sentencing disparity that was passed as a part of the 1986 Anti-Drug Abuse Act. That one provision of that policy resulted in 100-to-1 sentencing disparity for crack and powder cocaine, how that bears out in terms of admissions into federal prison were that 86% of people admitted into federal prison for crack offenses were African American. The disparities that that represent are for a range of different practices that didn't just start on sentencing day with the defendant, but started with high levels of enforcement in certain communities, police priorities, police practices, the discretion of prosecutors, including U.S. attorneys, to charge defendants depending on their role in the drug trade, stacking criminal penalties for certain defendants, multiple mandatory minimums, that led to pressuring defendants to plead guilty because of a fear of spending the rest of their life in prison. And so that is one sort of organizing narrative around what explains this curve. Other policies also contribute to this. I mentioned the truth in sentencing provision, which was incentivized as a part of the 1994 crime bill. Many of you probably are aware that federal legislation that was passed in the early 90s incentivized states to pass truth in sentencing provisions, and most states have those today. So people sentenced to prison for certain for statutory penalties that are categorized as truth in sentencing are required to serve 85% of their minimum sentence, and that also contributed to lengthening terms of confinement in the 90s, and also contributed to driving rates of incarceration in this country. And so the issue with the United States is we send people to prison for more things than they would get sent to prison for than in other Western democracies, and we send people to prison for longer. So next slide, please. So, I mentioned the crack powder sentencing disparity. Race is a huge part of the system. Again, from our perspective at the Sentencing Project, the racial disparity that's found throughout the system is because of a range of things, including police enforcement and police practices, but also the discretion at various parts of the system. So because of policies like that crack powder sentencing disparity at the federal level, and I forgot to mention that 12 states also have state-specific crack powder disparities. So Maryland has a crack powder disparity, Oklahoma has a crack powder disparity, and to change that, looking at state criminal codes have to be reformed. So because of the various practices and how that interacts with broader issues around race in this country, including socioeconomic factors, 1 in 3 black males born in the early 2000s can expect to spend some time under criminal justice supervision in their lifetime, and 1 in 6 Latino men can also expect to have a high chance of coming in contact with the criminal justice system. Next slide, please. I just want to reinforce that huge leap in the number of people incarcerated is because the United States has chosen to incarcerate so many people. Other countries, particularly other Western democracies, also experienced significant increases in crime during the same time period that the United States did, starting in the 1960s and through the 1990s. Those states did not respond with passing excessive penalties and criminalizing offenses that would send more people into prison. So Germany also experienced increases in violent crime in the 60s. They responded by holding their prison rate flat. Finland, thank you. Finland also had a dramatic increase in their violent crime rate in the 1960s. They responded by substantially reducing their prison rate. So the fact that the United States politicians chose to pass more criminal offenses and enhance penalties that would keep people in prison longer were political choices, and to change that, we need to develop and build political consensus and political cover for politicians to move back to the early 1980s and to substantially reduce the number of people who are in prison. Next slide. So I went over the policies that have driven admissions to prison. We can talk about more in the Q&A if there's questions. Next slide. So just wanted to highlight that the impact of this is that it normalizes the experience of incarceration in many communities and what I refer to as high incarceration communities, and it calls fundamentally into question of what it means for this country to be a free society. Now we're going to hear from Courtney about collateral consequences and and the experiences of returning citizens, the range of collateral consequences that people are subjected to even after they have completed their prison sentence are something for us to continue to critique and challenge as a part of the conversation on mass incarceration. Next slide. So just quickly, there have been closures and there has been a modest decline in the prison population over the last couple of years. I'll just highlight that, you know, one of the big successes in terms of states being able to substantially reduce their prison population has been New York, which, because of a change in mandatory minimum policies for drug offenses, has reduced their prison population by 25% since the mid-2000s. California since 2006, due to a mix of things, litigation pressure, but also sentencing reform through the legislative process and through ballot measure, has released 46,000 individuals since 2006. So it is politically possible for states to substantially reduce their prison population. And in fact, we've been looking at this at the Sentencing Project, that at least 17 states have announced or closed prisons down. I'll highlight specifically Texas and Kentucky actually did move to close down private prisons. We, at the Sentencing Project, put out a briefing paper today that highlights a campaign in Texas in 2013 where they successfully closed 2 CCA prisons. It was a grassroots coalition working with the legislative champion to defund 2 CCA prisons in that state, and we can talk about strategies and tactics during the Q&A session. Next slide, sorry. So I mentioned California and New York in terms of advocacy. I'll also say for us, given that this is a district campaign, a local campaign, that some of our policy goals and local strategies might be around addressing upstream policies that send people into the prison system in the first place. There are lessons to be learned and looked at closely around juvenile justice advocacy in the district. And this group might want to talk specifically with some of the juvenile justice advocates who've experienced successes over the last several years. So those upstream policies might focus on police practices, particularly given the conversation around Ferguson and Staten Island, and also given this opportunity around targeting the CCA contract, look at capacity for diversion programs and alternative to prison programs to prevent people from hopefully coming into contact with the criminal justice system to begin with, but certainly from going into jail or into prison. And, you know, I think this is all in the background of the issues around criminal justice are sort of being mainstreamed right now. And again, we can get into the discussion in the Q&A, but there's bipartisan support. Newt Gingrich and Van Jones are going to have a conversation on the Hill in a couple of weeks. So DC, you know, so our local campaign can really take advantage of this political moment to push the conversation forward. Next slide. And so just want to wrap up by saying that my hope around this political conversation that we're in, and given this campaign that's coming together, is that we can really build hopefully we can work together to build an infrastructure that broadens out the concept of public safety overall, that it's not limited to arrests and admissions, particularly the critique around police and law enforcement practices, and that public safety isn't just about incarceration. It's about effective interventions that reduce criminal justice contact in the first place. And given the fact that this is the district, that this is a local community, I am hopeful that it offers an opportunity to advocate for intervention programs and programs that reduce contact with law enforcement. That might look like, you know, targeting nurse-family partnership programs. Those are child care programs to help at-risk parents in high incarceration communities. That program has been shown to reduce rates of arrest with mothers and their at-risk children. Those effective interventions might support, you know, working with ACA, the American Health Care Act program, in terms of implementation for stronger mental health support, to prevent people from going into jail to get their mental health needs met, but to develop an infrastructure and to broaden out an infrastructure outside of the criminal justice system. So I'll wrap up there, and thank you.